Hello! I am going to be talking about week 17 of my pregnancy, and again, hopefully this means I'm going to stay caught up now. And I look very similar to how I did in the last video because, of course, I'm recording this on the same day. So hopefully the audio is working better with this different microphone that I'm using. I do notice that the camera seems to be cooperating a little bit more. I'm not getting so much like focusing and unfocusing, but the lighting has a little bit to be desired. We're a work in progress. We will figure this out. So let's see here. So week 17, baby is as big as a pomegranate now. That's very exciting. Lots of fetal movement. My nausea is definitely going down. Every now and again, I'll have a whiff of a smell or something that'll send me running for the hills. I am still sleeping head to toe with my husband and not head to head to just prevent any breath getting on me. My poor son, he likes to try and mouth kiss me or breathe in my face or be like really close to my face, and I cannot stand his breath either. And everybody brushes their teeth lots, and it's not like we eat particularly gross food. It's just like the smell of breath, like regardless of what you've eaten or what you've done, it's just gross to me right now, and I cannot stand it. So I feel like my husband is feeling very neglected and very sad because there's not so much mouth kissing, just some pecks, but maybe that'll change throughout my pregnancy, or maybe we'll just have to wait until after my pregnancy. I think that in some ways this pregnancy has been harder on our relationship than our first pregnancy, and I don't really remember the mouth kissing being such a big deal, though I do remember almost puking in his mouth a couple times when we were pregnant with Oliver. So I don't know if I was just like being more of a trooper, and this time I'm like, no, or what. But yeah, so that's what's going on. And then plus, like we have COVID-19 going on. We have a toddler. I am working from home, but I'm not a homemaker. Like, I'm not a stay-at-home mother or wife right now. Like, I am working from home. So I think that that's putting a different kind of strain on our relationship as well, because I'm home all the time, but I'm really focused and engaged in my work. I'm not like worried about the dishes. I'm not worried about keeping the house tidy. So as a result, the house is getting quite messy because my priorities kind of go keeping our son alive, keeping him moderately entertained, and getting my work done so we can pay our bills. And like housework is not even on that list, as you can tell. And as you can tell, keeping myself groomed is not on that list either. I don't know why. My hair is all going all crazy. But so I think that that also is creating a strain. In addition to that, he has a very stressful job that he just started going back to a couple months ago. So I think that there have been some new additions to our life that are creating some undue strain. So that's a thought. I think it's okay, and I think it's normal to have some stress in your relationship during your pregnancy, and I think it's just helpful if you can communicate with each other and if you can just be patient with each other, because it's very easy as a woman who is experiencing so many bodily changes to take things really, really personally and to get offended really easily. And then if you're not being as close, whether that be physical or just emotionally or in any kind of way, and you're not really supporting each other the way you normally would because of your pregnancy, whatever that's going on, your husband can also, or your partner, regardless of gender, could start to feel some certain ways as well. And bringing a baby into the world is going to be emotional and stressful for anyone, regardless of if they're the one carrying the baby or not. So just be gentle with each other is what I would recommend. So I thought that this was interesting that this one is like decisions. Now that you're 17 weeks pregnant, you're starting to making firm plans. I don't think anyone is making really firm plans. I guess that's not really true because I have my firm plan of having a home birth, but yeah, so I think, and it's like, oh, start getting ready for things, and and make a to-do list, but don't worry if you don't get it all done and stuff. And I'm like, I feel like it's really like still very early. We're not even halfway through to be like making to-do lists, but I think I have kind of a just like survival mode going on right now. So I'm just like taking it a day at a time. And again, I'm going a little over time on this video, and my apologies for that. Please stick with me. So some of the things that it says in this app about what symptoms you might be experiencing are increased bodily fluids. I think I've mentioned this before in other videos, but this is definitely a thing for me. I am very sweaty, increased mucus, I have to spit a lot, very congested, and then increased vaginal discharge as well, and it's driving me crazy. There's nothing wrong with me, it just has a scent, and it's a normal scent, but it's a scent that is irritating me as a pregnant lady that would not be irritating me as a normal lady. Weird dreams, 100%. I've had so many weird dreams, and I remember this from being pregnant with Oliver too. Just like every night, the wildest like acid trip kind of dreams. Itchy boobs and belly. I remember reading this the other day and then being like, I don't feel that at all. And then immediately going for a walk with Oliver and scratching my belly the whole time. So I think that, and I'm scratching my belly right now as I say this, I think that the moral of that story is that yes, but I'm not so itchy that I'm considering it a symptom yet. More rapid weight gain. I feel like I've had like pretty steady weight gain, but maybe it will pick up now. Kelly mentioned to me last night that he was like, oh wow, like you're showing a lot more than you did when you were pregnant with Oliver. When you were pregnant with Oliver, you weren't showing at all at this time. I don't know if that's true or not. I can tell you that the outfit I'm wearing right now, I wore on the last day of me being pregnant with Oliver. And I feel like I would have enough room to be 9 months pregnant in this outfit still. Like, I think that it will last me my whole pregnancy. But that's just something that I was like, yeah, maybe. That is true that I'm showing more and earlier this time. I'm not sure that there's a weight gain thing, though. Stretch marks. I never had any issues with stretch marks in my first pregnancy. I think I just have very stretchy skin, so I'm very lucky. But who knows? I could have them this time. So something that happened this week is I had my first appointment with my hypnobirthing coach. So I took a lot of really lovely notes. I used hypnobirthing for my previous pregnancy and birth, and I just loved it. I thought it did wonders for everything, and I'm going to share more and more throughout my pregnancy of what I'm doing in terms of preparing my body and my mind for going through labor. But that was our first session. It was really great to catch up with her. Obviously, it's been a while since I've talked to her face-to-face, so we do like or face-to-face. We were on video conference because of COVID-19, but we do talk via social media quite a bit throughout the year, just commenting on each other's pics, maybe sending messages here or there. So I will talk more about that in later things, but I do want to just give her a plug. She's amazing. Elevation Hypnosis, I believe her business is called, and this is the program we're working through, which is the Hypnobirthing program. So thanks so much for tuning in for this week's episode, and hopefully with any luck, next week when I do week 18, I'll only have to record one video and post it right away, and then I'll be able to keep up to date on all my subsequent weeks. Fingers crossed, knowing that probably won't happen. Thanks so much everyone for watching, and have a great day.